All right. And where do pharmacies have the greatest opportunity to close diabetes related gaps?
Pharmacies see patients far more frequently than most healthcare settings. Many patients visit monthly, but may only see their primary care a few times a year, if that. This frequency creates opportunity. Pharmacies can identify patients overdue for A1C testing, those with uncontrolled diabetes or those struggling with adherence. Offering point of care testing removes barriers like scheduling delays and transportation issues. Instead of telling a patient to schedule a lab draw, which in their busy schedules might not fit in, we can say, let's check it today. That immediacy closes gaps before they become complications.
Welcome to the Pharmacy Quality Solutions Quality Corner Show. Buckle up and put your thinking cap on. The Quality Corner Show starts now.
Welcome, everyone, to the Pharmacy Quality Solutions Quality Corner Show. I'm your host for today, Ashley Raymer, Clinical Transformation Consultant, Pharmacy at PQS by Innovacer. And this is a special episode that is meaningful because we are releasing it on Diabetes Alert Day. We're talking about how pharmacies can transform diabetes care through hemoglobin A1C testing, closing care gaps, improving quality performance, and using EQUIPP along with EQUIPP Academy to capture and sustain impact. Did you know that 1 in 10 adults in the US have diabetes and nearly 1/3 don't even know it? That means millions of people are at risk for serious complications every day, and many of them walk right into your pharmacy. Today, on Diabetes Awareness Day, we're talking about how pharmacies can set up, close care gaps, and make a real measurable difference in patients' lives, starting with something as simple as a 5-minute A1C test. Before we dive deeper into our topic today, let's take a moment to introduce our guest and fellow PQS by Innovator Associate, Terilyn St. Pierre, BSN RN. Terilyn joins us with a diverse clinical background, beginning her career as a paramedic before transitioning to emergency nursing. She has since focused her expertise on home health and value-based care, providing her with practical understanding of the patient journey across different care settings. In addition to her work with us, Terilyn remains active in nursing education as a clinical instructor at the nursing school she attended. Her combination of frontline experience and commitment to the next generation of clinicians makes her a perfect fit for our discussion today. Terilyn, welcome to the show.
Thank you so much, Ashley. I'm really excited to be here today, especially on Diabetes Awareness Day. This is such an important topic. I love the opportunity to share practical strategies and tools that pharmacies can use to make a real difference for patients with diabetes. I'm looking forward to walking through everything from A1C testing to how EQUIPP Academy can help the team implement these services efficiently and confidently.
All right, Terilyn, let's start at the foundation here. What is hemoglobin A1C and why does it matter so much?
Hemoglobin A1C is a measurement that reflects the patient's average blood glucose levels over the past 3 months. Unlike a single glucose reading that captures that moment, A1C provides a long-term picture of diabetes control. It's used to diagnose diabetes, monitor treatment effectiveness, and guides therapy adjustments. Elevated A1C levels increase risks for complications like neuropathy, kidney disease, vision loss, and cardiovascular events. Many patients don't fully understand their A1C number means. When pharmacies take the time to explain it and connect the number for real life health outcomes, we empower patients to take control of their health. And empowered patients make better decisions.
All right, and where do pharmacies have the greatest opportunity to close diabetes related gaps?
Pharmacies see patients far more frequently than most healthcare settings. Many patients visit monthly, but may only see their primary care a few times a year, if that. This frequency creates opportunity. Pharmacies can identify patients overdue for A1C testing, those with uncontrolled diabetes or those struggling with adherence. Offering point of care testing removes barriers like scheduling delays and transportation issues. Instead of telling a patient to schedule a lab draw, which in their busy schedules might not fit in, we can say, let's check it today. That immediacy closes gaps before they become complications.
And then how does this connect to quality measures and performance?
A1C control directly influences quality metrics, including CMS star ratings and value based care programs. Maintaining controlled A1C levels reflects effective medication management and monitoring. For pharmacies and value based initiatives, improved outcomes strengthen both performance and reimbursement. Clinical care and quality performance are aligned when we improve outcomes, performance follows.
So let's take this all now and tie this into EQUIPP. So if it's not documented, it doesn't count. How does EQUIPP support this work?
EQUIPP provides visibility into care gaps and performance trends. When pharmacies perform an A1C test, EQUIPP allows that service to be documented in alignment with enhanced services programs. By entering the A1C result, documenting counseling, and outlining follow up plans, pharmacies ensure their work is measurable. EQUIPP transforms daily patient care into structured, reportable impact, giving weight and dollars to the work you're already doing.
So I believe there's something new coming that might be a little A1C playbook that you guys are going to be able to provide pharmacies with. So before we move into the demonstration part, I want to highlight the EQUIPP Academy section in that A1C playbook. So Terilyn, tell us a little bit more about the Hemoglobin A1C playbook that's coming soon and the EQUIPP Academy module that is available.
I'm super excited about this playbook. Inside the EQUIPP Academy, we are working on creating a comprehensive A1C playbook and step-by-step guide for implementation. It covers understanding the clinical importance of A1C, identifying patients, integrating testing into workflow, documenting in EQUIPP, and establishing follow-up protocols. It's practical, actionable, and designed for busy pharmacy teams. We are pleased to say that it is coming very soon. There's also a dedicated hemoglobin A1C module that breaks the content of documenting into manageable on demand lessons. Teams can learn at their own pace, building both clinical competence and operational clarity. The playbook bridges knowledge and exclusion. Paired with EQUIPP documentation, pharmacies don't just provide the service, they sustain it and measure its impact.
All right, so let's talk about accessibility. What is a CLIA waiver?
All right, so a CLIA waiver allows pharmacies to perform simple, low-risk lab tests, including point-of-care A1C testing. The CLIA waiver needs to be in hand in the pharmacy before a test can be performed. With this, pharmacies can perform a quick finger stick and get results within minutes, enabling real-time clinical conversations and elevating the pharmacy to proactive care setting.
All right, so what I gathered from that is get your CLIA waiver before you perform a finger stick. All
That
right,
is
so
correct.
let's walk through how simple the test really is. So, Terilyn, are you able to describe it by step, just for the listeners? And then I believe we are actually going to be showing a little bit of a demonstration here as well. So those of you who are listening, she will describe what she's doing step by step. And then those of you who are watching, you will be able to see it done.
All right, so first you're going to want to gather your supplies, and those supplies include, of course, your PPE, so some gloves. You're going to need the analyzer kit. You're going to need the packages that come within the kit. We have a bandage for care afterwards. We have alcohol prep, and then a cotton swab to help with the blood after we do the finger poke. So to perform a finger stick, you're going to put on my gloves here. That sound we're all familiar with. All right, so we've got our gloves on, and then we're going to take the patient's finger and we're going to clean it with the alcohol. We're going to allow that to dry completely before we do anything with it. While that's happening, you can open up our test kit. Inside the kit, they include a lancet, so we don't have to get our own. So with the Lancet, it's better to poke the patient on the side of the finger. If you're poking it right in the middle, they're going to be touching that all day long. So we're going to poke on the side, and then we're going to squeeze to get our drop of blood. In our kit is a small, clear collection device, and you're going to just touch it to the blood drop. We're going to take that cotton ball and we're going to give it to our patient so that they can hold. We can also give them the bandage so that they can, or we can place the bandage to control bleeding. So now in our kit, there's another little tube-like device. We're going to take our collection device and pop it into the tube. And that sends the blood in here. We're going to rotate it a couple times. And then we're going to grab our step 2 kit. And when we open that up, it's our test cartridge. We're making sure the numbers align on the cartridge and the device. When we put that in, it tells you to wait the cartridge into the device. It tells you to wait. Now it's saying sample. So we're going to take the bottom of the tube off and press it into the cartridge. Now the cartridge is displaying run. So that will run. It takes about 5 minutes for that test to run. And then we'll have our results. It'll show right up on the monitor. And then, of course, we'll want to wash our hands and put our sharps in sharp and clean up.
Seems like the hands-on work part of it takes less than 2 minutes. So besides the results, it's almost like that takes longer than actually doing it. So I'd say that's simple and effective and pretty easy to integrate.
Yes.
So Terilyn, what do you recommend that pharmacies do while this analyzer is running now for these 5 minutes?
So a good practice would be to log into EQUIPP, navigate to the patient profile, and document the A1C in the enhanced service section, including the date, the counseling, and follow-up. By the time the result is ready, you can fill it in and the other documentation is complete. So it'll be efficient and impactful.
So while doing this, I know you kind of walked through everything you were doing. Do you have any practical tips for the pharmacy teams on taking A1C?
Again, making sure that the hands are warm, using the side of the finger so that they're not touching that all day, avoiding excessive squeezing as that can cause some bruising and discomfort to the patient. Check the cartridge, storage and expiration date, making sure everything is within proper use. Most importantly, use the results as a teaching opportunity. That conversation drives change.
All right. So if a pharmacy wants to take immediate action on this, what would you recommend that they do? How do they get started?
The big thing is that CLIA waiver, starting with that. The process is fairly quick, and it's all online automated now. So you used to have to send in payment, and that took a while. But to designate a diabetes service champion and use that EQUIPP weekly to identify eligible patients. Small steps create lasting momentum.
All right. So on this Diabetes Alert Day, here's the message that we are going to leave you with. Somewhere today, a patient walks into a pharmacy not fully understanding their A1C. They might not know their risk or that small changes could prevent life-altering complications for themselves. So that patient might walk into your pharmacy. Pharmacies are no longer just dispensing medications. You are monitoring chronic disease, closing care gaps, educating patients, and preventing complications before they happen. So a 5-minute test, immediate documentation, a conversation that changes a life, that's impact, that's leadership, and that's the role pharmacies play in diabetes care. So Terilyn, thank you for sharing your expertise today and the little demonstration for pharmacies to be able to see how quick and simple it really is. And thank you to all the pharmacy teams listening for the work you do every day to improve patient lives. We'll see you on the next episode of the Quality Corner Show.
Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes. And we need your help in sharing this podcast with friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.